want to thank you for the opportunity. I must say that I love being in a room full of many earlier career researchers. I hope this was in person for me to be able to interact with them and get to know each other. But I'm really impressed with what you have been able to say. And thank you so much for meeting with me and for the opportunity. It means a lot to me. My name is Jude Kong, and I'm the Executive Director of the Global South Artificial Intelligence for Pandemic and Epidemic Preparedness and Response Network. I'm equally a professor at York University. I will be talking about the Global South Artificial Intelligence for Pandemic and Epidemic Preparedness and Response, tackling global challenges as one. The aim of this talk to me will be around introducing you to the various projects that we are doing in the aim of establishing a relationship in terms of people that could be interested in some of the projects that we have ongoing in the 16 hubs that we have in the Global South. I will, because of the sake of time, I may not have time to point to the various projects in detail. But if you have time, please do pay attention to our website, the AI for PEP, and then get to see the projects that we're doing. And if there's any interest in any of the project in any country, please do get to me. I'll equally, before I start, I would like to acknowledge that I am speaking from the indigenous land, and I'm based in York University, which is established in an indigenous land. So I will talk about the mandate of the network that we have formed. I'll talk about our conceptual framework, our strategy, and the various areas of focus. The reason here is to point out to the method that we are using, point out to the various projects and the regions, and then if there is any researcher here who is keen on a particular region or a particular issue, a problem, and you would like to work with us, do let me know. I can put you with our partners or work together as we do meet regularly every other week to work on different projects. I'll start with our mandate, and to build on the mandate, I will build a story which is based on why I formed this network, which started with the Africa-Canada Artificial Intelligence and Data Innovation Consortium, towards the success of what we did in helping communities and government and fighting pandemics, to where we are now with trying to prepare and respond to ongoing outbreaks or future outbreaks that may emerge. So I'll present the reason why we came up with that and the approach. So I was born in Cameroon, in a very small village. And again, when I speak of Cameroon, you could think of it as any community in Baltimore, or you can think of it as a community if you're watching from Canada, the indigenous community, or any small community within the country, or another place where you're watching from. Growing up here in Cameroon, this is my village actually. In this village, we had only two people with a car actually. And when we were happy, self-content, not thinking far beyond, you have everything from your farm. Actually, these are my plantains, I planted them. I just always proud of you. But you grow up in here, you cultivate, you're happy. But if a disease were to strike you here, for you to go to a hospital, there was just one car, and the hospital was found in Cameroon. They were in my division. Each of these have a provincial hospital. So Kumbu tend to be the bigger area in my division, but I was in Jackie subdivision in a small village, and one government hospital here, but a lot of Catholic and Presbyterian hospital, other private hospital in Kumbu. So with one car in my village, you had to knock at that person's door. And that person would take you to the government hospital in Jackie with one family doctor, the specialist. And by the time you can get to the family doctor, he may have traveled to other villages to see other people, and you're bound to move to Kumbu. Or most often than not, you may go to knock at the door of the person, because people tend to go to the hospital when it gets out of hand. Knock at the door of the person with a car when they have taken another person to the hospital. So through this, people self-medicate, a lot of people die on the way and all whatnot. I never imagined seeing a doctor growing up till a certain age. I wasn't sick, but doesn't mean I was not affected. My system used to fight infections itself. And when we were building this, when you look at this type of community, like my community, and I'm so proud of people and a lot of things. This here is in Kanana, in gold mining town in South Africa. Most of this mining takes place in this type of community, leading to various diseases that spread in this community. And just like myself, I was raised by a single mom in this community. This is what you find in most of these communities. Here, this is my mom, my sisters here, with no job, working the farm and trying to take care of this family when you get back from the farm. But there are a lot of things where this mom struggle to ensure that they keep to helping these kids, single mom, a lot of when something like COVID come in, it affect them. Or if everybody in a small community like that were to die in Cameroon, actually, I don't think Yaoundé will care. The central system will not care because it's a small village, right? Nobody cares about such a community. And again, I'm just trying to paint a picture of the interest of AI for pet. And this is, again, this is not my mom. I took this picture from a website in Cameroon, but this is exactly how our kitchen was growing up. And you cook here, but there are a lot of disease, respiratory disease that could stem from here, but there's no study around this. It's not touching, it doesn't touch the core of what the central system. If you go to Yaoundé, you don't find this. But if you come to my village, this is what we have. And so the question will become, how do I use my knowledge, or how do we put together people that care about these communities, people that are far away from the central system, that can be able to help them in different diseases? And that's where we come from in our approach and the way we work. You look at this, during COVID, this is Bamenda, which is the closest town to where I grew up, the furthest town, but the biggest town. And this was in the heart of COVID-19, actually. A friend took this and sent to me. But when you look at this picture, I just want you to pay attention. You mostly see women, a few men standing there, which means that women like my mom, again, I'm not being biased given I was raised by a single mom, but women like my mom will be affected by this because they have to take care of their kids. Again, men are doing their other activities, which is completely different. Women have to be in the market to sell the product from the farm, to take care of this. And if there's an outbreak, they will not stop going to the market. This affects them differently. And this speaks to the type of solutions that we want to create. So we think that there's need for proactive solutions for disease outbreak. Proactive in the sense that when things tend to be reactive, then in a small community like mine that's far from the central system, everybody can perish and that will not touch an inch. Nobody will feel that something happened to anybody anywhere. So proactive solutions will help people in communities like mine. Poor health system will help strengthen it and ensure that, well, if something were to happen, we know ahead of time before it happens, rather than reacting, because if we have to react, nobody will care. You have a lot of women in such communities playing a bigger role. And when you consider all variables as one without looking at the gender transformative approach, you end up not addressing the issues correctly. And so by speaking to that, when we look at these proactive AI-enhanced solutions, they need to be gender transformative. They need to be explainable to society at large, responsible for policy, and locally relevant to that community. And that's what we put in place to set up these networks. So we have 16 of them. These blue ones are just the nodes that are working with a network. 5 in sub-Saharan Africa based on the number of low and middle income countries, 3 in Latin America, and then 4 in Asia, and then 4 in North Africa and the Caribbean. Why I form a wide ad hoc at York University in the indigenous land here. The aim is to just deepen how you can create these proactive solutions to help improve public health preparedness and response to emerging and re-emerging diseases. Then you establish and support a network, knowing fully well that you're decolonizing recession is not really something that just happened once. You need to build people to support each other, look at what they're doing in other countries and adapt that. And again, you know fully well that if you don't bring in government in place, whatever you come up with will not be implemented. So we work with government directly. Our framework is built on the foundation. And again, when I speak here, we have multiple projects that are built on this. For sake of time, I may not be able to go into those projects, but I will paint a clearer picture. Our foundation of any project is based on SDG 3 and SDG 5, health and well-being for all, and gender equality. We ensure that we have timely, these are the pillars of our network. We ensure that we have timely and reliable data for public health decision-making. So a lot on data, resilient and strong healthcare system, that's what we work to do. The inclusion of communities like mine and other vulnerable groups of people into the network, where we have 5 pillars: earlier detection, which means that we need to identify a spillover before it happens, creating earlier warning frameworks, then mitigation, responding to an outbreak when it starts occurring. How can we create AI algorithms to do that, models to do that? And then mitigation and control of developing epidemics, while acknowledging the fact that human health is not dissociated from animal and environmental health, taking the One Health approach or the planetary health approach in general. And using AI as a catalyst, I want to stress on the fact that it's a catalyst and not the end goal. The end goal is addressing this issue. Our strategy is identifying that for you to do anything, you need to move from a point of staying at York University or in a university in the city in Johannesburg and claiming that you know what happened in the community better than the community. So we plan with the communities, we act with the communities, and we build capacity in the communities. So we learn from communities before we build this. So we present ourselves to communities as told. Before our work, what we noticed was that there's a disjoint between policymakers and researchers, as well as communities. Yes, government inform policies within communities, but government do not listen to researchers within these communities, and researchers and communities are disjoint. So what we want to do is to bring everybody on the table. And I really love when Zoe told me that they want to look at interdisciplinary perspective. That's where we pride ourselves. So we bring people from different disciplines with different tools that can be used by these communities to solve the problems that they identify. Then we put them on the table with the government. They present the problems in the community, and then we present ourselves as tools. Again, the idea of intersectional feminist and decolonial framework is very, very vital, where we're learning from the communities. To us, decolonization is not just a metaphor, but a means for us to be able to solve the issues that we are facing. And we, just to spell here, we ensure that whatever AI algorithm we are building is locally relevant to the community, is explainable to the society at large, and responsible for policies. Responsible, is accountable, is auditable, is compliant, ethical, respectful, safe and secure, explainable, equitable, fair, interpretable, reliable, reproducible, transparent, trustworthy, unbiased, and then local is autonomous, caring, connecting, decolonized, human and community-centered, inclusive, intentional, intersectional, just, practical, protecting, process-based, and sustainable. It's only when all of these are made that we move on to collect data, design the model, deploy them, and observe them. And the success that we have with COVID-19 in Africa, we were the key person, and we use COVID-19, particularly in South Africa, that has a great impact, proof to the framework that we have. And so I thought I should bring this framework because it really, really helped a lot in the work that we did with COVID-19. And when we look at the various regions, again, there are particular projects here, and I want to touch out, I just decided to put this project, and I want to call on you to look at our website so that you have an idea of the type of projects we are working on. For instance, we're looking at zoonotic diseases in Senegal, where we're working with the communities, with the government, and looking at spillover dynamics before it happens. How can we create AI algorithms to look at those vector-borne disease? Same with Ghana. We're doing same with in Ghana. In Cameroon, we're looking at SEM, just working, bringing people from computer science, veterinary school, and public health to see how you can design framework to address vector-borne disease in Cameroon, both vector-borne disease, respiratory, and neglected tropical diseases that are happening. And if you move across, just to speak here in India, we're looking at how can you wastewater-based surveillance for antimicrobial resistance. And speaking, just moving across, there's several of these. Just in Dominican Republic here, we're equally looking at artificial intelligence and eco-epidemiological-based earlier warning system for improvement of public health response to airborne viruses in the Dominican Republic. So we meet with all of these teams, and in Brazil here, just a number of them, we are building. I just thought I should talk about auto AI pandemics, where we are building a set of AI models, take an sample of these such that if there's a pandemic, that can just be taken and used by policymakers with no knowledge of the algorithm. So we train them on how to use all those models for different things, both biologists and different fields. So there are a lot of several projects span across this, which I really want us to have a conversation on. What interests you? If your interest is on ensuring that you create telehealth for vulnerable communities, we have one here in the Philippines that's looking at that. If your interest is building a blockchain algorithm to save data, we have one in Malaysia looking at that. If you're interested on respiratory disease and area warning system, we have one in South Africa. Vector-borne disease, there is Cameroon, there is Senegal, there is Ghana, there is Dominican Republic, and there is Indonesia. If the interest is on ensuring that AML, we have Morocco, we have Tunisia, we have Palestine, and as well as India. So it all depends on the interest. If you're interested on TB, we equally have a project in Morocco looking at that, as well as DRC. So if the interest on that, then it falls along those areas. But one thing I wanted to point out is looking at all of these and analyzing the data, and I must say that we had 272 applicants, and then we selected projects that represent the region from these 16 projects. You will realize that as you try to collaborate with different regions, when it comes to different regions, priorities are different. If you look at sub-Saharan Africa here, this is MENA, which is Middle East and North Africa. This is Latin America and the Caribbean, and this is Asia. You realize that while Africa is still mainly focused on detecting earlier detection, spillover dynamics, and Africa is still equally looking at ways by which they can mitigate existing outbreak, regions like Latin America that are already way advanced are mainly focused on, if an outbreak comes into a country, earlier warning systems. So this is what they are focused on here, or earlier response, no longer the spillover. So when you look at these different regions, you realize that the tools they are using, the AI tools, are addressing different issues based on the region. Looking at this, you realize that all of Africa, both MENA, which is because of North Africa, the fraction of this because of North Africa, and Africa really are still looking at earlier detection. And a lot of this is looking at responding to existing ones. But when you look at LAC and Asia, given the number of the way they have grown over the years, you realize that they are no longer looking at earlier response, earlier detection. And this is analyzing all the projects that were submitted that we're working with. So again, I want to acknowledge the IDRC for supporting this, for believing in this, and funding this team and bringing them together to work together. I really want to thank Zoe for meeting with me and discussing the interests of the group. I was really, really passionate when she told me the explore collaboration between the different teams. And when I came in here and saw the number of earlier career researchers present, I was really touched, because some of these issues, a lot of people may relate to it in a way that they care so much about. That's what I have found in a lot of my colleagues that I meet with them, and I sell these issues. Again, you may sell it to some other people and may not be as passionate as most earlier career researchers, but I'm really impressed. And to end, I want to say that there's a need for gender transformative proactive solutions for disease outbreak preparedness. We should never create a solution about a community without getting them involved. Nothing about a community, like the saying goes, without a community. There's need for us to solve this issue. We need to partner with communities. We should stop designing models in our offices, claiming that we know better what the problem is in the community, and going and telling them, this is your problem and this is your solution. For us to solve issues in the communities, we need to learn from the communities. We need to work with the communities, build capacity in the community, and present ourselves as tools. We need to break silos. I'm glad with the interdisciplinary teams that you have here. We need to break silos and work at interdisciplinary team, and then reducing biases. Always test, validate our algorithm and ensure that we get different feedback loop, so that we get, if people see that this is not applicable to their community, we get that very early on as we build those algorithms. And then there's need for buy-in from policymakers. And then I really care so much about the decolonial approach. And again, I want to thank you, and merci beaucoup à tous. Please join us. Let's tackle global challenges as one. Please do reach out to us. Look at our various projects on the website, and if something interests you, let us know.